Hello everyone, Namaskar. I am Dr. Sanjay Mishra, medicine consultant from Delhi. In this video, I will be talking about heart attack. Uh, that is the most common cause of death worldwide. So, what do you mean by heart attack and what are the synonyms? The terminology heart attack is used also as myocardial infarction, that is a pure medical terminology. It is also called as a cardiac infarct, an angina attack. Mostly angina is used for only pain, but also used as angina attack. Some call it as cardiac arrest, whereas cardiac arrest is not as equal to a heart attack. Cardiac arrest is stopping of the heart, stopping of the beating of the heart. That is cardiac arrest. But in common terms, in common public, it is being used as a cardiac arrest, as a heart attack. The prevalence, it is really high. So as per the WHO website, it is 17.9 million people die each year because of CVDs. So this is heart attack and stroke combined, but still a very large number. So heart attack is the first cause and the second cause is stroke. In India, if we see, it is estimated around that 1/4 of all deaths happen due to cardiac and stroke origin. So only because of cardiac and brain, 25% of death is due to these two. Now, what are the symptoms of heart attack? The usual symptoms are usually shortness of breath, chest pain, nausea or vomiting, anxiety, sweating, and dizziness. Uh, there is a typical location of the chest pain, which is specific for cardiac attacks. So this location can be upper chest, can be in the substernal radiating to the neck and jaw. We received many people from the dentist. Person go with a complaint of toothache, and then in X-ray they find nothing, and then they send to physician, and then on ECG comes out to be a heart attack. The substernal radiating down to left arm. So left arm pain should be considered as a symptom of a heart attack. Substernal radiating down to left arm, in the epigastric region, in the neck and jaw. There can be a pain just in the neck and jaw, and that is the reason people go to dentist. Left shoulder and down in the both arm and in the back. So there are different types of heart attack, one of which presents as a pain in the back. Now, what are the first aid that can be given till the patient reaches hospital or till the ambulance arrives? First thing is that we should help the patient to be in a comfortable position, either sitting or lying, that doesn't matter. We should assure the patient doesn't panic, because the panic causes increase in heart rate, and increase in heart rate will cause increase in oxygen demand. And heart attack is basically lack of oxygen going to the heart muscles. So the more the panic, the more severity of pain will be. We should not let him move around. Strict rest, because each movement will increase the oxygen demand and will increase the pain and severity of the heart attack. We should assist the patient to take his prescribed medication. Usually heart attack happens in patient who is already having occasional chest pain, so he should be having some medications. So we should give those heart medications if he is taking, and give a constant reassurance not to panic. Help is there. The person who is assisting can say that he's there, nothing to worry. And patients should be either taken to the nearest hospital or called for help. Now, what are the medications that can be given even if a patient is having first time heart attack? So Disprin is a common drug where each first aid box, each household have dose. So that Disprin or Ecosprin, which is common in first aid boxes, 300 milligram can be given to be chewed. If there is a lipid lowering drug, anyone, it can be given. Preferably, it is atorvastatin, and it is of 80 mg. A person who is on a lipid lowering drug usually is either 10 mg, 20 mg, or 40 mg, and accordingly, that number of tablets should be given so that it reaches 80 mg of atorvastatin. If the patient has a sorbitrate, well, can be given sublingual below the tongue. If but first the attendant should determine the BP is normal or low. If the BP is low, do not give sorbitrate. If the BP is high or normal, well, one tablet of sorbitrate can be given below the tongue. Other than these medications, no medications are to be given. And reassurance is the must, because as I said, panic will cause more problem and more severity of the problem. Now, we looked on the do's of heart attack, what are things can be done. What about the don'ts? Do not leave, should be the first principle. Do not leave the patient alone. Why? Because most deaths happen due to heart attack in the first hour of the attack. It is this time that a patient can have a cardiac arrest, that is stopping of the heart, and he can die. Do not delay. First reason is, of course, deaths can happen in the first hour, so we should not delay. And the other we will see later. So either we can take to the nearest hospital or we can call an ambulance. The third most important thing is do not drive. Suppose a person is all alone at home and he feels chest pain. He should not drive to hospital when alone. What can he do? He can call an ambulance or he can call a neighbor, someone who can attend him. Because, like I told, cardiac arrest or stopping of the heart can happen, and it mostly happen in the first hour of the heart attack. So if cardiac arrest happens instantaneously, the person goes unconscious. So he won't be able to help himself. He won't be able to drive. He won't be able to do anything if he is alone. So this is very, very important message. Do not drive to hospital, and the person who is attending the patient should not leave the patient alone. Why not delay? One of the reasons, yes, cardiac arrest can happen in the first hour. The other thing is that there is a golden time. In the first 3 hours, the clot is soft and medications can be given so that the clot is dissolved. So in places where there is no facility of angioplasty, in places where angioplasty is too far away, in cases where angioplasty is not affordable, the only outcome that we can think about is to give medication. And to give the medication, the clot blustering medication, we have a golden time of 3 hours. So we should not delay. Angiography and angioplasty is the first ideal choice. So wherever the facility is available, we should go it for the first directly without losing time. If not, then clot bustering medications is the choice. If the time passes, if it is more than 3 hours or 4 hours, then there is no choice of that medication, angiography, and then angioplasty is the only way out. So I want to stress that most of the deaths in cardiac arrest happens in the first hour of the attack. So a person who is attending the patient should not leave him alone, or the patient himself should not be living alone by himself or driving by himself. He should call a neighbor, he should call a friend, he should call an ambulance, and better wait than thinking that it's just a 5-minute drive and I can reach the hospital. The chances are that you may not be able to reach the hospital. So I hope the severity and the gravity of this heart attack is being perceived. The prevalence is very high. So the incidents happening in and around is most probable. So everyone should be knowing what to do and what not to do. I hope this video is helpful to everyone. If you like it, please share it among your friends so that this simple message is being spread and lives are being saved. Thank you very much.